Is my hair thinning getting worse? I've lost hair during a year or so. It's been getting thinner all over my head, but it's mostly visible at my crown. My eyebrows have also been thinning. I have 3 pictures. The first one is taken January 2016, and the other 2 are recent, today.
Thank you for your question. You've submitted a question with 2 photos, and you state in your question that you've been losing hair, and the 2 photos you submitted, one is from January of this year, and the next photo is several months later. And you're asking about the presence of hair thinning, and you also mentioned that your eyebrows have also been thinning. Well, I can certainly give you some guidance as to how to proceed given this concern. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed in our practice which we use to non-surgically treat male and female pattern hair loss with over 99% success using a treatment that involves the use of platelet-rich plasma and acellular matrix. That being said, I would like to give you just some overall perspective as to how we evaluate hair loss in our practice. First of all, it's important to establish the diagnosis. In our practice, the majority of patients who come to us reflect essentially what is the majority basis for hair loss in the general population, which is 95% of hair loss is genetic pattern hair loss, male and female pattern hair loss. Now, when we evaluate a patient, we also ask about age of onset, the rate of progression. We look at family history. We look at the age of onset within the family. And then we do a proper evaluation with a microscopic evaluation, standardized photography. Now, one of the things that I am concerned about with this history is that you mentioned that your eyebrows are also thinning. Generally speaking, for male pattern hair loss, we don't expect to have concurrent eyebrow thinning. So, if there is any possible alternate diagnosis, something that is inflammatory or of a scarring nature, you should be seen by a dermatologist to at least establish that you don't have any other cause for hair loss. Assuming that you still have male pattern hair loss, I can suggest to you the different options we present to our patients. First is the pharmaceutical option. Pharmaceutical option includes the use of topical minoxidil, or brand name Rogaine, as well as the use of oral medication called finasteride, also brand name Propecia. Now, these drugs have their benefits and their limitations. It is not unusual for someone to start their journey in treating their hair loss with buying Rogaine or minoxidil. And it's applied topically, and it does help a little bit, but doesn't stop progression. When it comes to finasteride, the challenge is that you have to take a pill daily, and studies have shown that a lot of men do not continuously take these pills daily. By the second year, the majority of people stop taking them. Now, there are exceptions. We have patients in our practice who I've been prescribing finasteride for since the introduction in 1997. So there are people that can take this pill daily. The challenge we are dealing with now is that there's concerns about long-term sexual side effects that are been associated with these drugs, although from the medical community that question still remains open. That being said, we developed a treatment in our practice based on a wound healing technology we were using for when we were doing hair transplants called hair regeneration. Briefly, it's a combination of acellular matrix that is used for wound healing combined with platelet-rich plasma and other factors that we developed over time in a way so that we can get 99% success in terms of stopping progression of hair loss, reactivating hair that's not been growing, as well as inducing the shedding of thinning hair and the growth of thicker hair. This works for both men and women, as I stated, 99% of the time, and with more than 5 years of data, we have seen long-term benefit well beyond 5 years. We still treat everybody as individuals, and we follow people very, very closely. So the take-home message is that if you want to do something about your hair loss, do something sooner rather than later. The limitation of any treatment, whether it's pharmaceutical or surgical, as well as non-surgical like hair regeneration, is where you're at, how fast you're progressing, and the presence of hair follicles. We're treating people as young as 17 years old or in their late teens who are coming to us with their parents or with someone who can establish for us, and sometimes we take biopsies to further establish, but the onset of hair loss can be relatively young. And so the earlier we catch someone, the better it is. So that being said, I would recommend you meet with a physician, figure out what your cause of your hair loss is. Although your photos reflect more of a diffuse pattern, which is consistent with genetic pattern and statistically is more likely to be genetic pattern, it's very important to still have a proper evaluation and get the right diagnosis and then learn about your options based on that diagnosis. So I hope that was helpful. I wish you the best of luck, and thank you for your question.